Good afternoon. My name is Christy Peeler. I'm going to be presenting my quality of improvement plan to Brittany Carr. She's a fellow nurse in the ER. And this is Abby Griffin. She is a future nursing student. So the clinical issue I decided to cover was the shortage of nurses that we are experiencing nationwide. Now this can bring many issues to the nurses that are already working during the shortage. This can cause delays in patient care. This can cause mental and physical strain on the nurses. And this can cause dissatisfaction in the patients that are receiving the delays in care. The solution to this is the nurse residency programs. Now, a lot of institutions have already implemented this nurse residency program. This reduces turnover rates and this raises the satisfaction in the new graduates of nurses. The role of leadership in the nursing shortage. Managers should be able to step in and step onto the unit and be able to help the nurses that are working short-staffed. This can decrease mental and physical strain on the nurses. They should be able to also collaborate with the staff nurses and come up with a solution that is realistic. Some evidence-based practices that I have found. After implementation of a 6-month to a year-long program, the dissatisfaction of jobs has decreased. Many nurses after nursing school, they often go through a preceptorship program. Now, me and Brittany went through the preceptorship program at Chipola, which was, about 3 months long, but we don't feel like that was long enough. It's nothing like getting that hands-on experience. We get plenty of the academic experience from the books and all the stuff that we cover in nursing school, but we just don't get that much hands-on experience. We have the simulation labs and all that good stuff, but it's nothing like working on the unit that you're specializing in, especially. So learning the skills that you use the most is what brings satisfaction to new graduates. So if they are able to get with a preceptor and stay with them for a longer period of time in their chosen specialty, they're able to learn the skills that they use more often and they'll be more happy with their job, meaning that they'll stay in nursing. Some of the retention rates from these nurse residency programs increased from 35% to 97%. So that's a drastic increase of keeping nurses within the profession. The American Association of Colleges and Nursing School presented a 95.6 retention rate of nursing graduates after implementing the nurse residency program. So, like I said, that'll just keep nurses in the nursing field and help to reduce the nursing shortage that we're going through. Now, to be able to implement the nursing residency program, we'd have to go to the dean of nursing, and we'd also have to go to the dean of the entire college. We'd have to show them the evidence that nursing residency programs work, which is abundant. There are already some hospitals that have implemented this, and they state a lot of satisfaction for themselves as a hospital. They're able to pick from these pool of graduates that have gone through this residency program. So they know they're already trained in their specialty, they know they're going to do well, and that they're going to succeed and stay for a longer period of time. With the students that go through the nurse residency programs at this hospital, they also state satisfaction because pretty much for the same reasons. They're able to learn more, they're able to stay for longer because they're satisfied with the job, and they know the real expectations of the chosen department that they have chosen. And they would also have to find the college would have to find a hospital that is agreeable to keeping a student for that long. It's not really realistic for the college to have that many adjuncts for as many students as they have. And they wouldn't be able to pay salaries for that many adjuncts. So it's just easier to have the preceptors that are already in place for the preceptorship program to just keep those students for a longer period of time if the hospital is agreeable to that. The college would also have to choose a length of time that would be appropriate for their nurse residency program. As I stated earlier, many hospitals have already implemented a 6-month to 1-year program. So the college would most benefit from a period of time between that, anywhere from 6 months to a year. So that can be 2 semesters, that can be 1 semester, anything that's pretty much longer than 3 months that they already have in place. To evaluate this would be very simple. We'd just be able to keep track of nurses that are going through this nurse residency program. We'll be able to get the objective data by getting percentages calculated on their satisfaction, on their retention rates. And we'd also get subjective data by doing surveys where the nurses can say if they're satisfied with their job, if they feel like they were better prepared, and that would be the best way to evaluate that. So all in all, nursing shortages put a lot of strain on the nurses that are working through it. The nurse residency programs would help with this. To implement this, we would have to go through the college, and they would then have to go through the hospital. And the evaluation of this would just be by doing simple surveys. And that is my quality improvement project. Thank you. We're going to be doing a brief Q&A session. So Brittany, as a nurse, how do you feel about the nursing shortage?
I feel like it puts a lot of extra stress on me because every day I go into work and I'm not sure if we're going to have enough nurses to cover all the patients. And then if there's not enough nurses, then I have extra patients that I'm not used to taking care of, and I feel like it's hard balancing the time between each patient when it's already hard because I work in an ER, so it's busy anyways.
Right. And Abby, how do you feel about the nursing shortage?
Well, for me personally, I have a 10-month-old, and if I were to take my 10-month-old into the ER and I didn't feel like he was getting the attention and the medical attention that he deserved in a timely manner, then I'd feel uncomfortable. I wouldn't want to bring him back. So I feel like it's important to be properly staffed and to have enough nurses on your staff. That way people feel comfortable going to your hospital.
Right. All right. So the second question I have, how would you feel about implementing the nurse residency program, looking back on it since you've already been through the program?
I feel like it would have made me feel a lot more prepared going into work because, really, which I worked as a PCT in the ER before I became a nurse. So I kind of knew what I was getting into, but, not really knowing what you're getting into as a nurse going into work, it's really stressful because, you have no idea. You just go in and they kind of throw everything at you. And so I feel like it would have helped better prepare me a lot more.
And Abby, as a student going into the nursing program, how would you feel about having to go through a nurse residency program?
I think it would be more beneficial just because I don't necessarily know what I'm getting into yet. But I feel like in any situation, the more practice, the more time you put into it, the better prepared you're going to be for the situation.
Mm-hmm. And how realistic do you think implementing the nurse residency program is?
I feel like for the school, it wouldn't be that difficult. Just because, you already have to find preceptors and you would just tack on that extra amount of time to the schooling, so it wouldn't necessarily be just a 4-semester program anymore, so it would just be a little longer. But I think with the actual preceptors, they would maybe feel a little more stressed about it, knowing that they have to have a student for an extended period of time, whereas they usually only have to have, 100 and something hours before they're done. But so it just kind of depends on which side you're looking at there.
Right. Now, Abby, how do you feel like realistically looking at the nurse residency program? What do you think?
I think it's realistic. I mean, I've been to a school that's transitioned from doing a regular preceptorship to a longer, more like residency program. And I mean, they seem to do it with ease, and the students love it. So I think it's very realistic.
All right. Well, thank you.